Hello, I am BGant. My presentation is about universal mental health screenings in schools across America. Are they effective tools? One out of 5 children has a diagnosable mental health disorder. What is universal screening? It is the systematic assessment of all students on academic and socio-emotional indicators for the purpose of identifying students who are at risk and may require support that varies in terms of level, intensity, and duration. Problem identified. In the United States, approximately 14 million children have a mental health disorder that interfered with their ability to function at home and/or school. Approximately 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life. Children aged 8 to 15, the estimate is 13%. Each year, 14 to 20% of children and youth are diagnosed with mental, emotional, or behavioral health disorders. Only 45% of youth with a mental health diagnosis receives treatment, and only 24% of those individuals receive care in the school system. Students with emotional and behavioral problems are likely to face negative outcomes such as low academic achievement, social difficulties, and criminal activity. Schools are slow to implement mental screenings of children despite their capabilities of screening in large numbers. Approximately 11% of adolescents have a depressive disorder by age 18. 4 to 8% have a major depressive disorder and at risk for negative life events, including suicide. Nearly 8% of teens aged 13 to 18 have an anxiety disorder, and symptoms start around age 6. The next 4 slides are images of different mental health screening tools that are used in schools across America. The first image is the Basic 2 BEST screening system. It identifies students with needs in both the academic and social domains. It can identify internalizing and externalizing problems, school behavioral problems, and adaptive skills that are noted by teachers and parents. The next image is the SCARED screening tool. It has been validated in multiple studies identifying anxiety symptoms in children age 8 and above. The first image is the PHQ-9, which is a commonly used screening tool to screen adults for depressive symptoms. The second image is the PHQ-8, which is a modified version of the PHQ-9 to screen adolescents for depression. The first image is the RAPS screening tool. This is a brief, time-efficient tool used for identifying risk behaviors contributing to morbidity and mortality, as well as social problems in adolescents. Risk behaviors that can be identified using the RAPS screening tool are diet and exercise, violence and safety, substance use, unintentional injury, depression and suicide, and sexual health. The next image is the multi-tiered systems of support. This is a framework that focuses on individualized academic and behavioral health. Each student is assessed for elevated levels of mental health behaviors. The first image is the SIBS behavioral screening tool. This tool was designed to identify students at risk for internalizing behavior disorders. Some examples of internalizing behaviors are not talking with other children, acting in a fearful manner, avoiding or withdrawing, and not standing up for oneself. The second image is the SEBS behavioral screening tool. This tool was designed as a counterpart to the SIBS behavioral screening tool. It assesses externalizing behavioral patterns. Some examples of externalizing behaviors are displaying aggression, arguing, defying the teacher, and disrupting others. The third image is the Social Skills Improvement System Performance Screening Guide. This tool was designed to efficiently measure academic and behavioral indicators related to school success. It measures 4 domains: pro-social behavior, motivation to learn, reading and math skills. Six evidence-based studies were conducted using various mental health screening tools in several schools across America. The study results of the first study conducted by Spleet et al. Revealed that universal mental health screening combined with multi-tiered systems of support can detect a greater breadth of risk and provide expanded opportunities for prevention and early detection. The second study, conducted by Hartman, Gresham, and Bird, revealed that the technical adequacy results of the SIBS and SEBS, in contrast to the BEST and Social Skills Improvement System Performance Screening Guide, showed similar rates of students being at risk for emotional and behavioral problems. The third study, conducted by Donahue, Goodman Scott, and Betters-Bubin, indicated that the basic 2 BEST denoted between 9 and 13% of 944 students in grades 4, 7, 9, and 10 had elevated mental health and behavioral needs, and 5% of students in grades 5 and 6 also had elevated needs. In the fourth study, conducted by Allison, Nativo, Mitchell, and US, indicated that the PHQ-9 identified 11.54% of 182 students in grades 6 through 9 were positive for depression. The SCARED screening tool for anxiety identified 27.47% students that were positive for anxiety, and 7.69% of students were identified on both screening tools as having positive depression and anxiety. The fifth study, conducted by Salerno and Barnhart, indicated that the validity and internal reliability criteria for the RAPS screening tool was established with 41.3% prevalence of depression risk identified, in contrast to the PHQ-A, which identified 22% true prevalence of depression risk. In the sixth study, conducted by Chen, Dowdy, and Quirk, the student BEST and the teacher BEST revealed students with higher percentages of suspensions, unsatisfactory behavioral grades, and office disciplinary referrals were consistent with the predictability of students' emotional and behavioral profiles, which validated that students were at greater risk for behavioral and/or emotional problems. Barriers are universal mental health screenings are recommended by state and federal government agencies but are not required. Therefore, schools are not penalized if they do not implement mental health screenings. Some schools are reluctant to conduct behavioral screenings due to fear of stigmatizing kids. They have concerns regarding efficient, effective methods of supporting identified youth and behavioral problems. So once they've identified the students, do they have the effective methods and tools to implement any programs or interventions? Inconsistent school counselor and teacher participation with screenings, and lack of parental consent. Parents are verbalizing their concern about their children being labeled as having a mental health problem. Therefore, they are reluctant to participate in any type of mental health screening for their children. Other barriers include inadequate time and staff needed to implement the screenings and provisions of interventions. There is no tracking system for the mental health screening process. Therefore, no one's accountable if they perform any screenings or if they don't. And lastly, many schools lack the necessary resources that are required for mass screenings, such as funding, limited number of school counselors, and limited school psychologists. Recommendations. In wake of the devastating losses and tragedy of recent school shootings, federal, state, and local government agencies must regard policy and practice changes that include comprehensive preventive measures such as universal mental health screenings in all schools across America. Early detection and accurate classification of emotional and behavioral problems with universal screenings and multi-tier system support presents an opportunity for prompt referrals, assessments, and interventions such as counseling and treatment. Proper training programs for school counselors, teachers, and administration is a crucial part of conducting universal screenings. This includes collecting and utilizing student data to understand student needs and determining the effectiveness of interventions and programs. National funding for a standardized computer-based mental health screening program. This may be an efficient and cost-effective method of identifying, addressing, and monitoring mental health needs in the school, whereby avoiding potential privacy and ethical issues, as well as a deficient tracking system. Lastly, eradicating the traditional wait-to-fail model of referring students for a psychoeducational evaluation. These students merely end up in special education classes rather than receiving the proper screening to address their emotional and behavioral needs. Implications for practice. Universal mental health screening is a research-supported technique that has been used for more than 30 years to identify students at risk for emotional and behavioral problems. The screenings are a preventive, systematic, and standardized method of assessing every student for predetermined criteria with an aim of providing early identification and intervention. Universal screening with multi-tiered systems of support should be an integrative practice implemented in all schools across America. Evidence suggests that prevention and early intervention can reduce and/or eliminate the severity of behavioral and emotional problems in school-aged children and youth. There are numerous evidence-based screening tools available for identifying various emotional and behavioral health problems among students. Research indicates that the screening tools are effective, efficient, and have proven accuracy and reliability. Schools are an integral part of the mental health screening process and should have support systems in place to implement universal screenings and evidence-based interventions. Students are required to have certain health screenings prior to attending school, such as immunizations, TB skin tests, and sports physicals. Therefore, mental health screenings should be a requirement for detecting common behavioral disorders that will ultimately cost the individual, family, and society. This concludes my presentation. The next 2 slides are my references. Thank you, and I hope you enjoyed my presentation.